So can you deadlift if you have a bad back? There's a lot of controversial information about this, but the short answer is no, don't deadlift if you've got a serious back injury like a slip disc, herniated disc, etc. that's actively acute and causing you problems. Now, that's not to say that you can't go into those sorts of exercises in the future, and that's what I'll talk about in this video, is you've got maybe a history of back pain in some part, but ultimately you need your spine to be able to deal with the stress of gravity above and beyond, carrying a shopping bag. Last thing you want is someone gives you a shopping bag, oh, my back's gone. That means your back is not strong enough to deal with the day-to-day loads that are placed on it, and any small thing will push it over the edge. So we do recommend that deadlifts and exercises like that can actually be part of a strengthening and stabilization process for someone with back pain. And once you've got out of that lower back sort of acute flare-up, you can get back into your deadlift. So I'm going to go through the things that you need to bear in mind when you're getting back into doing deadlifts. Number one, you have a lordosis for a reason. That is a nice natural curve through the lumbar spine. You should keep it when you're doing your deadlifts. Your lower back should have that nice gentle arch through it, and you should be bending from the hips. Whether you're doing Romanian deadlifts or standard deadlifts, that's neither here nor there. The lower back should not be going into flexion. If you do this, and you'll see people in the gym, probably next time you're in there, doing these sorts of deadlifts, and they're absolutely awful. They're rounding their back, it looks like a fishing rod, and a piece of disc is about to fly across the gym floor. So don't make that mistake. If you do your deadlifts properly, with good form, starting on a slower weight and getting that form almost mechanical in nature, whereby it's just straight down, straight up. The pivots are right at the hips. Your back stays nice with that nice lordosis, and it's just up and down, very stable. As long as you can make sure that your form is like that and you maintain that lordosis, keep your core engaged, you do very, very well. I would definitely not advise you using any sort of belts or supports. Unless you're planning on being a powerlifter or some sort of competitive athlete, you do not need to be using any sort of supports for your lower back. 9 times out of 10, people are using them in the wrong place. It's creating increased stress at the lumbar-sacral junction, and they're using it to kind of ego lift rather than lift weights properly and effectively. Remember, you're lifting weights to strengthen and increase the durability of your lower back so you can deal with the stress and strain of life, and maybe for some other aesthetic reasons as well. Wearing a belt goes against the fundamental reasons you're doing the deadlifts in the first place. So cut it out, don't use them. Hopefully you found this video helpful, and if you did, remember you can subscribe to our channel so you get updates. Hit the notification icon if you're watching this now on your desktop, and also there'll be a few videos just on the one side here that may be of interest. And remember, share the page with other people that may find it helpful. Most back pain can be resolved and avoided if it's dealt with soon or quickly with the right advice.